Hoping to ask you today about the situation involving Dr. Tam now revising guidelines to acknowledge the aerosol transmission of this virus. And have you considered how many of the record-breaking cases we're now recording could have been prevented if more people followed your directives to always wear a mask inside public spaces?
Yeah, so I don't think Dr. Tam single-handedly has revised documents, as we've talked about a number of times. There is a continuum of how people are exposed to this virus, and we get it from breathing in droplets that somebody has coughed out, and those droplets can be of various sizes, and I've talked about this many times. In some cases, in some environments, particularly enclosed settings, so we're talking about there's been some public reports around a restaurant where there was limited ventilation and the flow of air from a fan probably led to people being exposed. There's situations like a wedding where the father of the bride was close to each and every guest, gave them a hug, kissed them, and there was spread in that wedding situation that was indoors. So we know that in closed settings, and we've seen it here, of course, in some of the bars and nightclubs, and we've tried to reduce those potential for spread in those scenarios. So those are the scenarios where we can get broader spread to larger numbers of people. And those are the things that we have been taking the measures that we've put in place to try and reduce those possibilities. That's why we limit church groups to 50 with enough space between people. We know that we've had an outbreak in the interior in a church group that was probably related to singing, but it was contained because we had a limit on numbers of people that can be in that facility. So I can't tell you exactly how many are related to that necessarily. We know there's transmission in workplaces, but for the most part, what we're seeing from the investigations that public health is doing in each of those situations, what we see is that it's when people are sitting together in an enclosed space, whether that's carpooling to work together, whether that's sitting in the lunchroom together, having a break together in a small enclosed space, whether we're working together without using the precautions. We know some of the larger outbreaks we've had in places like poultry processing plants. It's large numbers of people in an indoor environment, colder weather, which we're learning again that this virus probably transmits more easily in less humid conditions and colder conditions. So those are all factors that we need to take into place. And what we've learned from the now 40 million people around the world and the outbreaks that we're seeing is that when you have those layers of protection in place, that's what stops those transmission events. And wearing a mask is a really important layer that adds an additional layer of protection.